Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, and with me today is Efua from Cooper University right now as I believe, a administrative fellow. Efua, why don't you take us away?
Yeah, hello everyone. My name is Efua Tachie-Menson. I am the current administrative fellow at Cooper University. I've been in my role for a little over 6 months, and I have 6 more months to go. So nice.
Excellent. So you're right at the perfect halfway point. So
Absolutely.
that's excellent. Now, you started in a completely different region of the country, I think, right? At the what I'm reading here is Southern Virginia University. So tell us what I guess kind of led you to come all the way up here to Philadelphia.
Well, I'd say I used to technically live in North Jersey. I went to high school in North Jersey, and I went to college in Virginia. And while I was in college, during my second year, my parents decided to move to Texas. And so once I graduated a year early. And so once I graduated with a degree in business management. And once I did, I was like, I'm going to go back to Texas to seek out opportunities over there and see if I could find my foot in the door over there. And while I was there, I was also unable to find a job specifically. It was mostly sales jobs, and I wasn't really good in sales. And so I just didn't want to pursue that path. And both my parents are nurses. And so my dad was like, why not pursue something more on the administrative end of healthcare? And since I had a background in business, I decided to gain a dual master's degree. And so that was sort of my introduction into healthcare. And with that, I just sort of decided to just go around volunteering just to gain my foot in the door and understand a little bit more of the on the healthcare side, because all I had known prior to that was just like experiences from my parents, and I didn't have really any personal experiences working in healthcare, and so it was more of like a shifting career.
Makes sense. And you got both your MBA and your MHA, right?
Absolutely, yes.
Excellent, excellent. And what was your first volunteer experience in healthcare?
I volunteered at the University of Texas. It's a university branch of Texas, UTMB, in Galveston, and I was just doing clerical work. So I volunteered in the urgent care area for a little bit, just doing filing paperwork and all of that, and whatever administrative duties they had for me to do. And then at one point, I shifted into the oral reading area, where I'll just sort of send patients back and forth to see their loved ones when they were post op. And then at one point, I was transitioned into a specialty clinic, just calling people to remind them of the appointment. And if they wanted to cancel, I would do that. And so I just kind of bounced around, because I did tell the director of volunteer was that I really wanted to kind of bounce around and figure out my lane. And while I was there, through volunteering, I on the side was also substitute teaching as well. And so with that, I was able to gain a job from Baylor College of Medicine in the GME office. And so I got on board with them at the high like right when the pandemic hit in March of 2020. So I started working there. I was a contract role, and I started working there as an administrative support specialist. And just in the beginning, it was just I was told I was going to be doing administrative work, but once everything kind of shut down, I was given more responsibilities, and I kind of was able to lead all of their credentialing efforts for all onboarding incoming residents and fellows, over 500 of them. And so I did all their onboarding stuff, which was a great experience, because it gave me more of the educational side of healthcare, and it allowed me to figure out if that was a lane I wanted to pursue. And it truly wasn't a lane I wanted to do more something more on the hospital end. And so I just kind of sought out internships after that. So that was sort of
And
my,
that's when you went to Houston, HCA Houston, right? And you started working in quality.
yes, I guess through taking healthcare quality, a class in quality, I always knew I wanted to really gain a more hands-on experience in quality. And so when I onboarded for that internship, one thing I loved that the VP did was that she asked each intern, because there were three of us, she asked each of us which area we were interested in, and then gave us the lane she knew we were not confident in. And so infection
Oh, nice.
prevention was something that I was like, I saw it and I was just like, I don't really have a science background. I've never really been interested in that. And so I was just like, but I had a feeling she was going to place me there. And I remember the first 2 days I was just overwhelmed with, because I had additional training compared to my other fellow interns who did not have that because their lanes were a little different. And so it was just, I just had so much training and I just was like, oh my goodness, am I ever going to actually grasp everything? And one thing I loved was that they rounded every day. So all the infection preventionists would round every day and they would take me with them to see each patient. So to understand the catheter and all the different, like the labels, all of that. And so just understanding the clinical side and then the safety side of just making sure that every equipment, every device that it's in patients is safe and isn't infected, and just the importance of making a note of that. If something is wrong, letting the nurse know, hey, no, you need to correct that. I learned so much in that role that by the time I left, I felt like, oh my goodness, I truly enjoyed that, because that was definitely one of my favorite internships to do, because it gave me more on the a clinical side of healthcare while also an administrative side, because I did have some administrative duties to do. But I really enjoyed just the collaboration I had with the nurses and all of that. No one really looked down at me and said, oh, she's just an intern. And it was just like really questioning their ethics in when it came to putting the right labels on things, because every little thing is so crucial in on the clinical side. Because when you go to like those, like the NICU area, you can't really, there's no room for error. When you go to
Yeah.
ICU unit, there's really no room for error. And prior to me leaving that internship, I had the opportunity of being assigned part of the Joint Commission readiness. And so
Oh,
I
wow.
had certain departments where I would go check stuff, and then and I was given the authority to let nurses know when things were not done correctly and how they needed to fix it before I came back again. And so it was just, I really loved the VP over there really delegating to us interns, like these duties, because someday we are going to become leaders. So it was so important to her to do that with us. And I truly enjoyed that internship.
So then, after the quality internship, which sounds like a really thrilling experience,
Mhm.
I'm actually a little jealous in a way. That sounds excellent. I haven't done any hospital quality work, but I've always been really interested by it. So that sounds very exciting. And then you did another internship, and that was at the anesthesia back pain center.
Yes. So
That was a little bit longer, right?
yes, it was a little bit longer. It's a family owned business. It's just one physician. However, sometimes he does have his son come in, who's also a physician as well.
Nice.
So I got to do the back end of what, if he had an administrator, what the administrator would do. So I did a lot of like the billing, the coding. I did a lot of just all kind. I trained every single new intern that came over there. I kind of interacted with patients, called for reimbursement stuff with insurance
Mm,
companies. So I was basically the compliance person, the finance person, the
full
operational,
spectrum of
yes, the whole
operations.
spectrum. And so he really took the time. He wanted us, the interns, to really gain experience of what it looks like for an administrator, what an administrator in a clinic does on a day-to-day basis. And so it gave me that full spectrum, because I prior to that I'd never had any insurance experience. So it allowed me to understand the importance of, when you are, using those EHR systems, you need to enter the right coding and everything, because health systems don't get paid. Insurance doesn't really love to pay. And so any little error, you get denied. And so it's so important to not, lessen the error. And prior to me coming, they didn't have like a formal template going for it for training new employees. Intern. So what I did was I created a template that is currently still being used over there. That
Nice.
showed like a step by step of how to do everything. That way, when a new intern comes, they sort of use that as a mechanism to train them and give them, because you will you will come through bumps in the road with that, and so it's so crucial that you have something to lean on and say, okay. Because one thing about me is that when I'm being trained, I always take notes because I find
Oh
it to
yeah.
be helpful for me. And so once I created those notes, I just kind of like transcribed them into a Word document and made it as a template going forward, as kind of like the standard of work, the process just for each new intern. And also I had the opportunity to do CT scans because there are times where he wouldn't have anyone to do those CT scans when he was doing the injection. So I got to learn a little bit more about CT scans. So that was great for me, just a little bit more about just pain management, because that's a whole different realm. Like I done more of the operationals with quality in a health system, and going to a clinic is just a little different. It functions very different from a typical health system. So that was definitely an eye-opening lane, and it allowed me to figure out if that was a lane I wanted to pursue. If going the clinical, like a smaller clinic route would be something I would want to pursue. And I knew I wanted more. I knew I wanted to pursue more of a fellowship because I wanted to gain more of a broader experience at the end of it, and kind of like figure out where my next lane would be.
Yeah, that's what I was going to ask. You have an MBA and an MHA, which already kind of boosts your resume, and then now you're going to have a quality internship and then a full practice management internship. So over, kind of well over almost, I think probably 2 years or
Mhm.
close to 2 years of experience, and then you decide to do a fellowship,
Yes.
which a lot of people would probably opt to go into industry or start working, but you chose to kind of
Mhm.
pursue even more education. I want to know what led you to do that, and what has that process been like?
Yeah, I think for me, when I first started my administrative fellowship, during orientation, they briefly touched about the opportunity that MHA students get the opportunity to pursue a fellowship through various organizations, and I felt like pivoting, having a background in business management. I did a lot of accounts payable, like accounting internships earlier to that. I did not have any healthcare experience. And so I just felt like an administrative fellowship was like the right route for me, because I knew I wanted to sit in high level meetings with all like the senior leaders across the health system. I wanted to like just sort of understand their mindset when they make decisions, when they create processes in place for a health system, just the kind of project I wanted to learn, and be mentored by a senior leader, and figure out what my own type of leadership skills to identify, okay, what area specifically do I see myself for the next 2 to 3 years, like those short term goals, because you're never truly going to know it at this point in your career what you truly want to do for the next 10 years. you know Anyone, like healthcare evolves so much, and so I just kind of wanted to be in that thick of things where I'm able to hop around from different departments and get to work on different projects, and at the end of it be able to look back at this experience and say, okay, this particular department really resonated with me, and I could see myself doing this for at least 1 to 2 years, and then figuring out what my next move would be. And so that's really why I pursued administrative fellowship.
That's nice. I think that's a really good answer. I've heard different things from some fellows, but I do think the majority of fellows I've talked to, especially in hospital programs like Cooper or Jefferson, they do it for that similar reason. And so I think that's some nice motivation. I like that. I guess one of the questions I'd wonder too is like, how many of these fellowships did you apply to? Did you apply to a bunch or only a few?
Well, I love research. That's the one thing about me, and I did extensive research. It took me about 6 months to figure out, hone in on which, because I had a template, an Excel template going on like where I would look into the organization. I wanted to look at what their leadership looked like because I wanted to make sure it represented what I look like, because I wanted to align myself with health systems that I could see diversity in there, where I could see, okay, I have a future here. I could see myself growing professionally because that's so important in healthcare. You have to be able to figure out, am I going to be able to grow professionally? And so that was one part of it. And also like the location. The one thing the one advice I got from so many fellows when I was code messaging people through LinkedIn was that you need to make sure you love the city you are applying to. If you genuinely don't love that city, you're never going to be happy. And that was something that I took into account. I went to high school here on the East Coast. I went to college on the East Coast. I always knew I wanted to come back to the East Coast. Texas was never really it was like a midway stop. But
That's fair.
I always knew I wanted to come back to the East Coast, and that was my big plus. And I knew there were so many health systems, and so with that, I applied to, I believe, a total of 8 organizations. I applied to 8. I made it through to the first round and second round to, I believe, 3. Yes. So
Nice. That's actually really good.
yes, one
Yeah.
one I was super super shocked, which was UPMC. I made it to the final round, and I did not think I was going to make it because I remember the day I turned in my application. I just had gone through an accident, and and so I was in the ER for quite a bit, and then when I got home, I just submitted what I had, and I was just like,
Oh
I'm
wow.
probably not even
Okay.
gonna get like a first round interview. And when they reached out to me, I was like, this has to be the biggest joke. But I was so grateful for the opportunity. And when I made it to the second round, I was just really excited. And I also had the opportunity to connect with so many different people, because you go to these interviews and you meet people from different parts of the country, and you kind of build a connection with them, and you see them on LinkedIn, and you see when they post, when they get a role. So definitely it definitely was a great networking opportunity, despite not being able to get that. But it was a great networking opportunity. But I'd say just being open-minded, that was the biggest. If there's one thing I can say, is to be open-minded to you know the possibility but not attached to the outcome. Like, I remember being so set on a particular health system and I did not get it. And I felt a little defeated when I didn't get it. And I felt midway through that interview that I wasn't going to get it. But
Okay.
I still kept the hope, but I had a gut feeling that I wasn't going to.
Can I ask what health system that was?
It was Ohio Health.
Really? Okay. Interesting choice too. Yeah.
Interesting because that was the only one that was in the Midwest that I
I was
truly.
gonna say that's a little further than the
I
East Coast. Yeah.
know, absolutely. And that's something about me is I definitely like to try new cities, new states that I've never truly lived in. I'm not originally from this country. I'm originally from Ghana. So I moved to the States when I was 16. And so it was sort of like just navigating different states and seeing what I liked and what I didn't like. And so when I went there, I liked the pace of Ohio. And so I was kind of like, and I'd done a lot of research for every single organization. And I knew why I applied to each organization. And I reached out to so many fellows, and there were organizations where fellows would tell me, don't apply. And they were
Oh
truly,
man.
truly honest. They would give me, and I would say, tell me why, and they'll tell me why. And it's so important because when you're looking for a fellowship, it's going to be, I would say, wherever place you end up, it's going to be a place you stay for the next 3 to 5 years. So it's just really reaching out to those people, like, to discuss, hey, how's your experience? Because these fellows are truly truly honest. They tell you how it's going. They tell you when it's not going well. They tell you, hey, I think maybe this other organization. They tell you the truth. And that was something I truly appreciated about my through my networking on LinkedIn, and just code messaging people. People genuinely respond. And I'm a little bit of an introvert when I first
Mhm.
meet people, and so it definitely was something that was not normal for me. But I just, because I knew I wanted this so bad, I just kind of just code message people, and people would just, I would set up times to talk, and they would just give me the rundown of everything and tell me the positive, the cons, just longevity wise. Can, like, is there, there's some fellowships where you're not guaranteed that you will get a job post your fellowship. And and they will let you know, like, where, hey, you will get an offer once you're done, like, this is what that would look like. So yeah, it's just being open minded.
Really interested, I guess, in a few of the comments you made. One of our recent fellows I spoke with, our residents, excuse me, they were talking about how they actually got some offers and some interview offers for some programs, but they also had the issue where the people in charge of the program didn't look like them, didn't have the same experiences as them, and then they had another program which made them make their final choice was because they made them feel especially welcome. I guess I'm interested in how big of a role that played on the East Coast with the East Coast programs you looked at. This person was looking more in the Midwest, I think,
Mm.
which I understand the demographics of the Midwest are a bit more different. Sometimes they're a bit homogenous, but in the Northeast, we kind of, have much more diverse cities and areas. But I am interested to see how much of a role that played even in the Northeast. Were there health systems that you said, this doesn't feel like, my kind of people, this doesn't feel like a group that I would really fit in with, and whether that's for diversity reasons or otherwise, I'm interested to hear about
Yeah,
that.
I think I would say it played a huge part. I think it was definitely like maybe 60% of my decision. It played that much of a, because it's so I think, you have to be logical when you're applying to these positions. You have to be realistic, and I would say there are certain organizations where they almost, there's a certain caliber of schools they look at. Think, it's sort of that unconscious bias people have without recognizing that they do have it. you know we as a minority, we tend to take that into account when we make decisions. We tend to take that into account when we're applying for roles, because we want to see what, like, your leaders look like what does diversity mean in your organization, because that matters for somebody like me, because I'm coming in to figure out, okay, because the whole point of a fellowship is not just to leave that organization, to stay and grow a little bit before you decide, do I want to stay and grow here for an extended period of time, or do I want to go and try something new? And so, if you don't feel like I'm going to fit in, you wouldn't want to apply. And there were a lot of organizations where I I thought I would fit in, and in talking to the fellows, they're like, no,
Really?
this is not a great experience. And I definitely don't want to name those organizations, absolutely not. But they definitely, I was alerted by a few where people were like, no, you're not, don't apply. And they gave me and I said, why? Tell me why. Because it's so important for me to know why. The why has to play such a huge factor. If the why, and then I remember there was a fellowship I was interested in somewhere in Philadelphia, where the previous fellow quit midway through, and she said to me, I quit because prior to them hiring me, they hadn't hired another black girl in the past 2 decades. And when I
Really?
came, I wasn't being given the project I thought I would get. And so midway through, she quit and found herself another job where she's now content with. But that struck a chord with me, because it's telling, and so it's like, you want to make sure that the leadership looks like you. And so I really looked for organizations where I felt like I aligned with, and that their values and mission aligned with what mine was. Because just as you are seeking out a fellowship, you also have to make sure it aligns with who you are, because you do spend majority of your time at work. And if it doesn't align with you, it's like people can tell in the effort you put into your work and all of that. And so it's very telling very easily. So people can easily tell if you really, really, really want to be here, because we just currently finished interviewing and selecting a candidate for the fellowship that starts this summer. And it was so easy to tell the candidates that truly, truly were seeking out a fellowship, and the candidate absolutely had no idea what they were applying for. And it's so easy that you can tell, you can't even make it up. Like, you're like, oh, you just want a job, you just did not even take the time to try and figure out why, because you have to have your why with every single organization. Your why has to be so big, so loud, because in every personal statement you're writing, you have to personalize it and talk about why this organization. What is it about this organization that aligns truly with who you are at your core? Because at the end of the day, your moral compass comes into play. And if you don't align with them, it just doesn't make sense for them to recruit someone like you. So your why definitely has to be loud.
I think that's really good advice for all of our potential fellows and recent graduates, because some of them really do have a hard time. Their schools don't set them up. Not all the schools are as well funded or have as good of programs. And some students as well are, like yourself, you said, a little bit more introverted, and it can be challenging to get the right advice. Even myself, I haven't applied for a fellowship. I'm not done with my MBA yet, but it definitely is an area that there isn't as much information about as there is with like a medical residency or a
Mhm.
medical fellowship.
Yeah.
So you had this like huge, passion for coming to Cooper University. And I want to know, how has the experience been? Did it live up to the expectations?
So I'd say I'm going to start with my program here at Cooper is super, super new. Cooper, prior to me coming on board in the past, has only had administrative residents, and they actually transitioned from that into an administrative fellowship. And I am the first administrative fellow they've ever had at Cooper. So with that, it also comes with the risk and the challenges of it being a much newer program, not as well established as other organizations. So it has allowed me to sort of like figure out my own lane. Being the only fellow, it can be extremely isolating. I'd say that's definitely the one thing that no one really talks about, that I and usually in like a fellowship that is just one person, it's very extremely isolated, because you are in a weird role. While you are an employee of the organization, you really don't belong to any team. You kind of bounce around a lot from different teams. You don't really have an allegiance to any specific team, which is such, it can be such a great thing, but it can also be such a lonely path to walk. And so with that, I have two senior SVPs that I report to, and I do have like weekly like check-ins with them. But additionally, I also connected through one-on-ones with one of the institute VPs at Cooper, who was kind of taking me under her wing and kind of mentors me also on a weekly basis. So that kind of gives me that sort of coordinator role. She kind of plays that sort of coordinator role and supports me, and gives me guidance and puts me on project that she believes would be beneficial for my development and my for my career. So that's definitely something I appreciate. It's definitely had its ups and downs being in such a, because sometimes you walk into a department, or like, and then they're like, so what exactly is your role? You're an intern, because people tend to, even with the well established, I've heard other fellows say, the people take them for interns. And so it's a big struggle, and so it's just navigating this road. But I'll say the beauty that I've loved with my fellowship is the fact that I really came into Cooper at an interesting time. Cooper is expanding so much. I don't know if you've seen, but in over the next 10 years they're going to have be expanding in terms of buildings. And so with that, I've just had the opportunity to sit in these high level meetings that I wouldn't have gotten the chances to participate in as a regular employee, typical employee that went the traditional route. And so I truly appreciate that, because I have these architects asking for my opinion, and I would just be called out in a meeting and then they're like, "Yeah, what do you think?" And I'm like, "Me?" I'm like, "Oh my gosh." Like, and the SVPs are also great. They definitely do take the time to make me feel a part of their team, which is nice. But like, on an overall perspective, it can be super isolating, but it's also like, it's also rewarding in another way, because you go into these different teams, and there's some teams where you just kind of gravitate more towards, and that's okay, because you are such a you're like almost bouncing around from like foster to foster. And so it's like you just gravitate towards certain teams, and it just works out in your favor, where you just kind of just keep getting projects, because you have to put yourself out there. Through that, it's definitely brought me out of my shell, where I'm like reaching out to people and wanting to, "Hey, can I have a chat with you? Can I have a one-on-one with you, just to discuss, hey, I would love this project." And just you really kind of coming out of your shell, because you have to, you have to go after opportunities, because it is such a short span that you have for your fellowship, and it goes by so fast. I just hit like what, 6 months this
Mhm.
earlier this month, and now I'm like almost getting closer to my seventh month, which is crazy to think about. So the months go, but they fly by so fast. And so it's to just take up advantage of every second, because you'll never get this opportunity in your career. So that's something that I've loved with my fellowship.
I think that's really good information, even for me. And I know some people take kind of that, that salary hit sometimes. Some people, it's a bump, but I know some people, they do take that salary hit. Do you feel like, you said it's only a year, it goes by quick, you gain a lot of useful experience. Do you think for those who are taking a salary hit that the experience is worthwhile?
Um, Honestly, I would say if you know what you want to do for the next 3 years, I wouldn't advise you to go the fellowship route, simply because you do have an idea. I would say one advice, one of the senior vice presidents said to me, she's like, "What are your plans? What is your long term goal?" I was like, "I don't have one." She's like, "If you had one, that would be a problem, because you shouldn't have one at this point in your career. Having a long term, you're almost kind of like, it's almost like you're doomed if you do that, because you're setting yourself up for failure, because you've put yourself on this kind of like unrealistic path. And what if another opportunity arises, because I had the opportunity to, sit with all the senior leaders across the system, and had one-on-one chats with them, and just listening to their background and sort of where they are at now. That is not where they started. And so just listening to the interesting routes they've taken through their career, I would say if you know where you want to be the first like year or two, you don't truly need a fellowship. But if you're just truly unsure about what you want to do, then sure, go for a fellowship. It is a career, it is a salary bump, because in today's economy, that definitely plays a huge factor into whether or not you want to pursue that, because it is like you are taking sort of like a pay cut to come on board for a fellowship. But it is like, depending on what program you are, it can be a rewarding experience, depending on what you're seeking. Because I always say you have to know your why you sought it. You have to know the why are you seeking out a fellowship, like what do you want out of your fellowship. These are questions. If you can answer those two main questions, then sure, go for it. But if you can't truly give an answer, then maybe you should consider another path.
Do you know, now that you've been through it,
Hmm.
you said that one of the main reasons is so that people will know what they want to do, or they'll have a better idea. Do you know, now that you're 6, 7 months in, do you know yet? Do you have a general idea of where you want to head?
Kind of, in a way.
More defined than before.
Yes,
Okay.
definitely. Definitely. A little bit more. Yeah, a little bit more than I did prior to coming on board.
What can I ask? What areas you're most interested in?
I don't. I really don't want to incriminate myself right now, but
It's a totally fine answer.
I'd say I can list two areas that I've loved working under. I've loved working with the rev cycle portion of finance. I've loved working with that area, and also with the MDA team, the MD Anderson partnership Cooper has. I love working with that because I do get a lot of my projects from the MD Anderson at Cooper. I get a lot of projects from there. Currently on a few more projects, so I've loved working with that team. Everyone is super great, and just the projects I gain, I've kind of learned a lot. And so those have been good in terms of like things I hadn't done prior to this. Like I was reflecting just when I hit my 6 months, things I've accomplished, and I've been able to sit like participate in different departments that I've never ever experienced prior to coming here. So I would say
Nice.
those
Yeah.
are the
So what
two that stick out.
what do you like about revenue cycle? That's an interesting one. I want to hear kind of what you liked about it.
I think for me, I've always liked finance. I think I've always been a numbers girl. I knew accounting was in my lane. My dad, years decades ago, was an accountant, but I always knew debits and credits were not my thing in undergrad. And even though one of my professors tried to convince me to gain my my bachelor's in accounting,
Yeah.
I was like, absolutely not, sir, because accounting is not for me. And his classes were at 7:30 in the morning, and
Oh no.
I was not willing to do that because I did that for one class. I was like, never again. This is a nightmare. Never again. But I always knew I've always been a numbers girl. What really drew me to business really was watching Shark Tank. When I moved to this country, that was like the one show my dad and I would always watch, and I loved the way Mark Cuban thinks about the decisions he makes, the kind of investment he decided to invest in. And so with that, I always knew like I wanted to pursue business because I'm like when somebody talks about something they're passionate about, I start to think of it about it as a business, and what that could look like, what that return on investment could look like. Let's say you like baking cookies, like cost of labor. I just start to think about all those
Yeah.
streams. Like that's the one thing I love, is just my brain automatically goes to the business end because everything in my head is a business, and I've generally loved it, and that's really what drew me in. And in undergrad, I did a lot of accounts payable. I did a lot of accounting stuff, even though accounting truly wasn't my lane, but it was a repetitive. Accounting is more repetitive. You're doing the same thing over and over again. Whereas like with the rev cycle, I'll say I did a little bit of that with the billing and coding from the private care clinic, and so I knew I was interested in learning, expanding more outside of just billing and coding and just like pre-authorizations for insurance and all of that. I knew I just wanted to understand a little bit more, and so with that, I've been able to gain projects that are allowing me currently to just you know learn a little bit more about just the rev cycle of in its end of just what on a health system, what that looks like, because I've never done that on a bigger
Right.
platform. So for me, it's just gaining education on that spectrum. And right now, Cooper MD Anderson is implementing a BMT over here, and so it's like just gaining the education of what the payments is going to look like, and the DRGs and all of that. And so those are great things for me to learn. And
So I was so happy to have you on. Thank you so much for joining us. Our audience is going to really, I think, love this. I really enjoyed our conversation, learning about Cooper, learning about your career all the way back through Texas, your time in Virginia, and then now you're up here again in the Philadelphia, New Jersey region. So it's been a really interesting and insightful conversation. I couldn't be more appreciative.
thank you so much for having me. I'm definitely so much. I'm excited to definitely listen to this back and remember what I said, because I'm sure there's some piece of advice that these are things I wish a platform like this existed more, when I was applying, because definitely navigating looking for a fellowship is extremely hard. And just to tell people to not be discouraged and to just keep on going and keep sending code messages to people on LinkedIn, because people would always respond. Fellows are always receptive to talking to other people interested in seeking out a fellowship. And so I'm always happy to chat with anyone that wants to chat with me about just fellowship opportunities. And I thank you so much for having me.
And of course, this will be on LinkedIn, so everyone will be able to see your information and then go ahead and message you, of course.
Absolutely.
All right. Well, we'll definitely be talking again soon. So thanks again.